World-first device which aims to diagnose skin cancer, developed right here in Australia, and now it's one step closer to being made widely available.
Yeah, the microneedle patch has successfully been used in patent trials, validating the incredible technology. The new method means invasive skin biopsies could soon become a thing of the past. Let's bring in DermR Health Solutions' Stefan Mazy. Great to have you with us again. Now, we spoke in February and we said when it gets validated, come back in. You're there.
We did. I'm back.
Wow, congratulations.
Thank you. So we went all the way to the edges of Australia to do our clinical trial, and we proved that our solution was able to detect cancer in the exact same accuracy as all skin biopsies that were tested on the same patients.
OK, so how does yours work?
So we have developed a microneedle patch, and there's very unique structures within the actual patch itself. You can't see them because they're naked to the eye. But basically, if there's a lesion of concern, what the doctor or a clinician can do is they clean the area. They apply the patch onto the lesion for about 15 seconds. There's a little bit of pressure, a slight twist to dislodge some of the cells, and then you release it. And then with that, it collects about 10 or 12 cells, and that's suitable for our genomic test method. And the outcome of this is basically to highlight if this lesion does have any sort of cancer, whether it be BCC, SCC or melanoma, or 40% of the time when they're not cancerous, we can basically say, hey, there's nothing wrong with this lesion, so you don't need to get it cut out.
That's fantastic, isn't it? And obviously the fear is too, just having, it's just like a ballpoint pen, isn't it?
Literally a pen.
Is this going to get rolled out? Is this going to be the norm?
This is what we hope. So we hope that this is going to be something that can allow all Australians to have better access to skin cancer. Now, our clinical trial was out in rural and regional Australia where there's a massive skill shortage. And so being able to get this solution into the hands of nurses and allied health can ensure people all around Australia can have access to this. It's also the same price as a biopsy, so it's not like it's going to break the healthcare system. It's got the same reimbursable codes. So we tick a lot of boxes in terms of getting this out to the public, hopefully within the next 2.5 years. We still have about two really big clinical trials to do for regulatory approval. But from that point, our hope is within the next 2.5 years.
How bizarre. When you were in earlier, remember I said, I've got this thing on my nose, can you do it? And you couldn't do it because it was, you had to be in official trials. Then I went in and got it checked and had a biopsy and it ended up being skin cancerous. So in time to come, we'll be able to use the pen.
Well, this is the hope. It's quite scary as well. Like BCC, nonetheless, cancer is a cancer. So
good on you.
Just quickly too, before I let you go, could we be doing this at home?
So, look, in the long term, the goal is yes. So we want to be able to roll this out like you would an at-home COVID test. We still have a few little levels to go. So we've got the allied health and doctors first. But once that gets adopted, we do see this as at-home
like a bowel cancer test where you do it at home, you send it off and you get the results back.
Yes.
It's amazing, mate. It really is. Well done to you and your team.
Good on you.
Thank you so much.
Thank you.